Okay lah, listen up. I'm going to share something that might shock you. More than half of men over 40 in Singapore experience problems with erections. And here's the scary part. It's often the first warning sign of heart disease. This one really important. Cannot ignore. Look, I'm Dr. Natalie Teo. I'm a real person, not AI, not some computer-generated thing. I've been practicing urology here in Singapore for over 30 years already. I've seen thousands of men from Toa Payoh to Orchard, from hawker center uncles to CEOs, all dealing with the same issues. And today I want to talk to you straight. No fancy medical jargon, just real talk about 10 things that can destroy your erections and what you can do about it. Now, before we dive in, I need you to understand something very important. Your penis is like the check engine light on your car dashboard. When got problem, it's telling you something deeper is happening inside your body. Maybe your blood vessels getting narrow, maybe your hormones not balanced, maybe even your heart starting to have issues. Ignore it. You might miss the chance to prevent bigger problems down the road. Pay attention, you can turn things around. I know this topic can be paise to talk about, especially for us Singaporeans. We don't usually discuss these things openly, right? But listen, your health is more important than feeling embarrassed. I've been doing this for more than 30 years. I've heard everything already. No need to feel shy with me, so let me tell you straight. There are 10 things some you might be doing every single day that slowly damage your sexual health. These things affect your blood flow, your sensitivity, and even your long-term vitality. But here's the good news. Once you know what to avoid, you can protect yourself. Your performance, your confidence, your dignity, all can be maintained if you know what to do. Now let's go one by one. Pay attention because this one, very important. Number one, don't ignore changes in your penis. Wow, this one I see all the time in my clinic. Men come in only when already cannot walk at all. By that time, sometimes too late already. Listen carefully. Your penis is like a canary in a coal mine. When your erections start to weaken, it often means your blood vessels are getting narrow. The arteries in your penis very small, so they show circulation problems way before your heart or brain shows any symptoms. That's why men with erectile dysfunction, they have higher chance of heart attack within 5 to 7 years. Not trying to scare you lah, but this is the truth. Emotionally ignoring this means you're missing a chance to protect not just your sex life, but your whole life itself. Practically speaking, if you notice changes, whether it's taking longer to get ready or things not as firm as before, or you cannot maintain, don't brush it off. Don't say, I'm getting old already, normal lah. No, it's not always normal. Come and see me or any good urologist, we can help. Number two, don't try dangerous home remedies. I've seen it all in my 30 years of practice. Some men, they go online, see some weird advice, then they try all sorts of things. I've had patients putting apple cider vinegar on their penis, building devices from bottle caps and rubber bands, trying extreme stretching techniques they saw on some dodgy website. These things can cause micro tears in the tissue, damage your nerves, create scar tissue, and sometimes even cause permanent erectile dysfunction. Just last year, I treated a man who ended up in SGH emergency room with a metal ring stuck on his penis. The poor man was there for hours, very paise, and they had to use special tools to remove it. Please, if you want to use any aids like constriction rings, make sure they're medically designed ones that you can get from proper medical supply shops. Don't anyhow go hardware store and try yourself. Your penis is not a DIY project. Cannot play one. Number three, don't neglect hygiene. Okay, this might sound very basic, but I see this problem quite often, especially with older men who maybe never learned proper care. If you're uncircumcised, you need to gently pull back the foreskin, wash underneath with mild soap and water, rinse properly, and pat dry. Cannot just rinse with water only, otherwise smegma will build up. That's the whitish stuff that accumulates, and it can lead to infection, inflammation, and in very rare cases, even penile cancer. But the flip side is also true. Don't over clean. Some men, they very kiasu. They scrub too hard with harsh soap, thinking cleaner is better. No lah. This will strip away the natural protective oils and cause irritation. Gentle cleaning once or twice a day is enough already. Use mild soap. No need those strong antibacterial ones unless doctor tell you to use. Number four, don't ignore pain, bleeding, or lumps. This one, very important. Listen carefully. If you experience pain during sex, see blood in your urine, notice a lump, or see any ulcer or sore, these are never normal. They can mean infection, kidney stones, sexually transmitted infections, or in rare cases, cancer. I know it's scary to think about, but early detection makes a huge difference in treatment outcomes. Biologically, these symptoms mean your tissues are under attack from something. Emotionally, ignoring them only creates more fear and anxiety, and it delays treatment. Practically, if you notice anything unusual, please come and get checked. Don't wait until cannot tahan already, then come. And if any doctor makes you feel judged or embarrassed, find a better one. You deserve proper care without shame. Number 5, don't take risks during sex. Okay, this one some people feel passe to talk about, but I need to be direct. Penile fractures are real medical emergencies. When an erect penis bends sharply or gets hit with force, the outer tissue can tear. There will be a loud popping sound, immediate pain, swelling, and bruising. We doctors call it eggplant deformity because of how it looks. If this happens, you must go to emergency room immediately. Don't wait. Don't try to sleep it off. Go straight to A&E. Also, lubrication is very important. Like some men feel embarrassed to use lubricant. They think it means their partner not attracted to them. No lah, that's not how it works. Lack of natural lubrication can be due to hormones, medication, stress, or just natural changes with age. Using good quality lubricant protects both you and your partner, reduces friction, and helps you stay in control. Can buy from pharmacy. No need to be shy. The pharmacist sees this every day. Number 6, don't overheat your testicles. Your testicles hang outside your body for a good reason. They need to stay cooler than your core body temperature to produce sperm and testosterone properly. In Singapore weather, this is already challenging enough without making it worse. Long hot bath sessions, sitting for hours with laptop on your lap, or keeping your phone in your front pocket can raise the temperature and reduce your fertility and hormone levels. I know in Singapore, we like to go to those Korean spas and sit in the hot pools for a long time. Once in a while, okay lah, but don't overdo it. Also, if you work in an office, sitting down whole day, try to get up and walk around every hour. Give your body a break. Put your laptop on a proper desk, not on your lap. Keep your phone in your bag or jacket pocket, not in your pants. These small changes can make a difference. Number 7, don't grip too hard when you masturbate. Okay, I know this topic very sensitive, but I'm a doctor with more than 30 years experience. I've heard everything already. One of the most common issues I see is what we call death grip syndrome. When you use too much pressure during masturbation, you're conditioning your body to need that extreme level of stimulation. This makes regular sex less satisfying because the sensation is not as intense. Biologically, it desensitizes the nerves in your penis. Emotionally, it can leave you frustrated and feeling disconnected from your partner. Practically, the solution is to lighten your grip, add some lubricant, and retrain your body to respond to gentler, more natural sensations. It takes time, maybe a few weeks or months, but your body can adapt. Be patient with yourself. Number 8, don't smoke. If there's one single thing guaranteed to wreck your erections, it's smoking. I cannot emphasize this enough. Nicotine destroys the inner lining of your blood vessels, reducing nitric oxide. That's the chemical signal that makes an erection possible. When you smoke, you're literally choking off the blood supply to your penis. And it's not just about erections. Smoking also increases your risk of bladder cancer significantly, and that's one of the most aggressive cancers we deal with in urology. I know many Singaporean men, especially older generation, they smoke for many years already. Maybe started young, now very hard to quit. But listen, it's never too late to stop. Even if you've been smoking for 20, 30, 40 years, quitting now will still improve your circulation and reduce your cancer risk. Your body can recover if you give it a chance. There are smoking cessation programs at polyclinics. Can go and ask for help. No need to do it alone. Number 9, don't beat yourself up. This one very important for mental health. Many men link their self-worth to their sexual performance. I see this all the time. Men come to my clinic feeling like they failed as a man just because they had 1 or 2 bad experiences. Let me tell you something. Every man, without exception, has an off day. Maybe you're stressed about work, maybe you're worried about money, maybe you just ate too much at the hawker center and feeling bloated. All these things can affect performance. When you spiral into stress and anxiety about it, your brain activates the fight or flight system, the adrenaline response. That's the exact opposite of what you need for an erection. Biologically, stress hormones cause your blood vessels to constrict. Emotionally, it creates a vicious cycle of fear and failure. Practically, you need to remind yourself that your value as a man is so much bigger than one moment, one night, one experience. Talk to your partner about it. Most women, they are more understanding than you think. Talk to a doctor, talk to a counselor if you need to. But don't carry this burden alone. In Singapore culture, women are taught to be strong, to not show weakness, to just tahan. But this kind of thinking can make things worse. It's okay to ask for help. That's actually the strongest thing you can do. Number 10, don't stop using it. Yes, use it or lose it is actually scientifically true. Regular erections deliver oxygen-rich blood to the penile tissue, keeping it elastic and sensitive. Without regular blood flow, scar tissue can form over time, sensitivity fades, and there can even be a slight decrease in size. This is why nighttime erections are so important. They're nature's way of doing maintenance work while you sleep. Biologically, if nighttime erections stop completely, it can signal deeper health issues that need attention. And practically, even solo sexual activity helps maintain blood flow and tissue health. It's not just about sex with a partner, it's about keeping your body in good working condition. Intimacy, whether with a partner or alone, isn't just about pleasure, it's about connection, confidence, and maintaining your physical health. So, what should you do moving forward? Let me give you some practical advice based on my 30 years of experience treating Singaporean men. First, protect your circulation. Exercise regularly, even a 30-minute walk around your neighborhood every day makes a difference. Eat well, cut down on the fried food and sugary drinks. I know our hawker food is delicious, but try to balance it out with vegetables and fruits. Your blood vessels need good nutrition to stay healthy. Second, keep your hormones balanced, manage your stress. I know in Singapore, everybody's stressed about work, about money, about everything, but chronic stress kills your testosterone. Sleep well, aim for 7 to 8 hours a night. If you're having trouble sleeping, address it. And if you suspect low testosterone, come and get it checked. We can do a simple blood test. Third, stay safe in the bedroom. Use protection if you have multiple partners. Use lubricant when needed. Don't try risky positions or movements that could cause injury. Take your time, communicate with your partner, and remember that good sex is about connection, not gymnastics. Fourth, keep your hygiene simple but consistent. Clean daily but gently. Use mild soap. Check yourself regularly for any changes, lumps, or unusual symptoms. Early detection is key for any health issue. And finally, treat your erections as a vital health indicator. They're telling you about your overall health status. If things change, pay attention. Don't ignore it. Don't feel embarrassed. Just come and get checked. We doctors, we see this every single day. There's nothing to be paiseh about. Now, I've treated men in their 50s, 60s, 70s, even some in their 80s, who have restored not only their sexual health, but also their energy, confidence, and relationship satisfaction. It's never too late to make positive changes. Small steps done consistently make an enormous difference over time. I want you to hear this very clearly. Erectile problems are not the end of your masculinity. They're not a reason for shame. They're simply a signal from your body, and signals are meant to be listened to, not feared. With the right care, the right information, and the right support, you can maintain your sexual health well into your later years. If you found this information useful, please share it with other men who might benefit. Can share with your brothers, your friends, your kakis at the coffee shop. These conversations need to happen more openly in our Singapore community. Drop a comment below and let me know what's one change you're committing to today. I read all the comments and I try to respond when I can. I'm Dr. Natalie Teo, and I've dedicated over 30 years of my career to helping Singaporean men feel informed, confident, and empowered about their health. Remember, age doesn't mean the end of a vitality. With proper care and attention, you can enjoy good health, confidence, and intimate relationships for many years to come. Take care of yourself because you are worth it. Thank you for watching, and I'll see you in the next video.